Hello, welcome to my presentation. My name is Harry Hopkins and my student ID number is 1903063. This presentation is based on the Pharmacogenomic journal article, Pharmacogenomic and Drug Interaction Risk Associations with Hospital Length of Stay among Medicare Advantage members with COVID-19. As of the last 2+ years, COVID-19 has severely impacted older populations and strained healthcare resources, with many patients requiring long periods of hospitalization. Reducing the hospital length of stay reduces patient and hospital burden, which has been essential during the COVID-19 pandemic as healthcare systems have been under immense pressure across the globe. In the United States, hospitalizations represent nearly a third of all healthcare expenditures. In order to decrease these expenditures, healthcare systems will need to reduce the length of stay, as the longer a patient stays hospitalized, the more money spent in order to care for them. Adverse drug reactions, ADRs, can be a huge contributing factor directly linked to length of stay. ADRs can be preventable with the correct medication management. Okay, so the objective or aim, if you'd like, was to determine if the pharmacogenomic and drug interaction risks were associated with longer length of stay among high-risk patients hospitalized with COVID-19. The method used in this journal article was heavily data collection based. The data was gathered from a large database of medical and pharmacy claims from a US healthcare insurance company. Data was collected from 10,206 Medicare Advantage member patients admitted to hospital with COVID-19 between January 1st, 2020 and June 30th, 2020. Only patients' first COVID-19 admission was included and evaluated, and patients who died during their hospital stay were excluded from the study to remove potential confounders. So, in this study, there were independent and outcome variables that needed to be discussed. The primary independent variables were pharmacogenomic interaction probability, PIP, and DDI, drug-drug interaction severity. PIP is the probability that pharmacogenomic testing of 14 genes will result in the detection of one or more clinically significant pharmacogenomic interactions involving one or more medications on the patient's current medication list. DDI indicates the potential for adverse interactions among two or more medications prescribed to a patient, irrespective of the patient's pharmacogenomic profile. The outcome variable of interest was length of stay, of course, during the first COVID-19 admission. Okay, for our results. From the 10,206 patients with Medicare Advantage benefits admitted to hospital with COVID-19 between the required dates, only a cohort of 6,025 individuals met all inclusion criteria. And from these 6,025 individuals, most patients were female at 61% and had a mean age of 77 years. Overall, 42% of patients had a high or moderate PIP, indicating that among these patients there was a greater than 25% chance that pharmacogenomic testing would reveal clinically significant gene-drug or gene-drug-drug interaction. When reviewing results, patients were hospitalized for a mean 13 days. Patients with high or moderate PIP were hospitalized for at least 1 day longer on average compared to those with low PIP, while length of stay for patients with moderate, major, or higher DDI was similar to those with minimal or minor DDI. PIP was significantly associated with length of stay among all patient groups, except those with 2 or 3 conditions. Given the associations between ADRs and length of stay, the findings suggest that incorporating pharmacogenomic testing into clinical management of high-risk COVID-19 patients may shorten hospital length of stay. Even non-COVID-19 patients would benefit, as burden on healthcare system would be less. Overall, it was found that almost half of Medicare Advantage members hospitalized with COVID-19 could benefit from improved medication management, as 42% had moderate or high PIP and 48% had a moderate, major, or high DDI for current medications. However, there were limitations to this study, and this included that although this study showed the association between PIP and increased length of stay, it was not a study demonstrating that increased length of stay among COVID-19 patients was a direct result of adverse drug events that could have been prevented by proactive pharmacogenomic testing. They also did not take into account the severity of COVID-19, which could have had an effect on results. After reviewing this journal article, the conclusion I came to was that in this study, it showed that greater pharmacogenomic risk is associated with longer length of stay among Medicare Advantage members hospitalized with COVID-19, as patients with high PIP were hospitalized for almost 2 days longer than those with low PIP. If healthcare organizations were to address pharmacogenomic risk prior to COVID-19 hospitalization, this would seriously reduce length of stay. In the future, I would propose that a new study is carried out where the study demonstrates that an increased length of stay among COVID-19 patients is a direct result from an adverse drug reaction that could have been prevented by prior pharmacogenomic testing. Thank you for listening. Any questions?